continue the Nursing Leadership and Management Part 2, which is consist of 11 questions.
Oh, come on!
Now, without further ado, let's start by answering these questions. The delivery of care system on a medical floor is team nursing. On Wing A, there is a registered nurse, licensed practical nurse, a UAP to care 8 clients. Which task would be best delegated to the LPV or LPN? You can pause this video while thinking of an answer.
Yeah!
The question refers to task of delegation towards LPN or LVN. So you must know the difference between RN, LPN, and UAP. And you must know the tasks that they are able to do so. So according to this question, due to scope of practice, the RN should check vital signs and perform assessment of the post-op client. Always and always remember, assessment cannot be delegated to any of the LPN or UAP. It is only done by the RN itself and no one else. Also, physical assessment is within the scope of practice of the RN. So, letter A and letter D are both eliminated. You are left with both of the choices. So what do you think the answer? If you answer letter B, you are correct. Remember, the scope of practice of UAP or UCP involves completion of tasks. So the UAP should check vital signs and complete bed baths on the client. And letter C is not done by the LPN. Instead, it is done by the UAP. So letter C is wrong and letter B is the final answer.
Yeah!
For the next question, a nurse is delegating care of clients to an unlicensed assistant and licensed practical or vocational nurse. Which tasks should the nurse give the UAP and LPN or LVN? So this question involves delegation towards UAP and LPN. So just by looking at the choices, remember and always remember you cannot delegate assessment. Only a registered nurse can do assessment. That is why look at letter C. Although UAP can ambulate a client, but LPN or LVN should never do assessment on 2 clients. That is why letter C is eliminated. And also look at letter D. Though some institutions let the UAP measures vital sign, but again, LPN cannot do assessment, especially head-to-toe assessment. So letter D is also eliminated. In some facilities, UAP or UCPs are allowed to change dressing. So letter B might be correct. However, the scope of practice for LPN or LVNs does not allow them to administer IV medications.
Come on!
Though it is a piggyback medications, but LPN is not allowed. So the correct answer is letter A, on which UAP allows to measure vital sign and LPN or LVN is allowed to give oral medications on assigned clients. So that's it. For the next question, a nurse is preparing for the shift and makes the list of delegated tasks for the unlicensed assistant. Which task should the nurse delegate to the UAP or UCP? Task for UAP does not involve assessment. So just by looking letter B, though it is just monitoring, but it also involves assessment towards the drainage of the chest tube. So it must be done by a registered nurse. Then a client with dysphagia or has a difficulty of swallowing, it needs a very careful feeding because of the risk of aspiration. So it must be done by the nurse.
Duh.
So among the 2 choices left, as you can see, UAP is able to do vital signs, but then when a client has an elevated or low blood pressure, the nurse should recheck and assess the client for validity of information and changes in status. So it is also done by the nurse. So the final answer is
Oh no!
letter D, repositioning a client with severe weakness caused by multiple sclerosis.
Yeah!
Now let's proceed to the next question. A registered nurse who is the charge nurse for the shift is making assignments for the day. Which client should be assigned to the licensed practical or vocational nurse? So another delegation problem. So as you can see in the choices below, a 76-year-old client who is newly admitted with a chronic condition which is a type 2 diabetes exacerbated by an acute condition which is pneumonia is very at risk for changes in status. That's why it requires frequent assessment. And when we say assessment, it cannot be delegated because it must be done by the nurse. So letter C is wrong. Also look at letter D. The hemoglobin of the patient is 6.4, which is very low, which the patient might need a blood transfusion, and also the patient has unpredictable outcome. That's why it must be delegated to the RN, not LPN. So letter D is wrong. So among the two, a client with sickle cell anemia who requires pain medication every 3 hours would need frequent observation and assessment. Because of the RN's ability to problem solve and think critically, this client should be assigned to a registered nurse. That's why the answer is the 3-day post-op client who will be discharged tomorrow, which is stable. For the next question, the staff nurse who is in charge of the medical surgical unit for the shift is receiving 4 admissions. The emergency department is sending a client with hypertension and an exacerbation of heart failure, and a client who has pneumonia and a history of diabetes mellitus. The post-anesthesia care unit or the PACU is transferring a client who had a total abdominal hysterectomy and a client who underwent hip replacement. If the staff consists of 2 RNs, 1 on orientation, and 2 LPNs or LVNs, what assignment would be appropriate? So by looking at the question, in this case, the LPN or LVN should assume duties such as vital sign and assisting with ADLs. A patient with pneumonia, history of diabetes, and abdominal hysterectomy should not be assigned to the LPN because the case is very complicated and it needs further assessment, and their condition is very unstable. So letter C and letter D are eliminated. The RN on orientation should care for the client with medical conditions such as CHF, hypertension, and diabetes. They should not be assigned to the patient who is post-op client who underwent hip replacement because it is unstable. So among the choices below, the best option is the skilled RN should get the post-op client with the hip replacement and the abdominal hysterectomy. Because post-op clients are critical clients due to the risk of hypovolemia and shock. That's why the experienced nurse should receive the surgical clients. For the next question, an obstetric nurse is floated to a medical unit to care for a group of acutely ill clients. The charge nurse should assign which group of clients to the float nurse. Assigning a client to a float obstetric nurse requires critical thinking because there is a lot of consideration that you'll do. Like for instance, you cannot assign to this float nurse this client with an old cerebrovascular accident because clients who have acute conditions compounded by chronic health problems are more complicated and are better assigned to nurses with experience on the medical surgical unit. That's why letter C is wrong. And also, older adult clients can have fluctuations in status, placing them at high risk for complications, which is not an ideal situation for the float nurse. So letter D is wrong. So among the two, the correct answer is letter A. Because the float nurse from the obstetric unit can be assigned clients who have abdominal surgery since the nurse likely has experience working with clients having cesarean section. That's why your final answer is letter A. Now for the next question, a nurse plans to delegate some responsibilities of client care to a licensed practical nurse. Which task should the nurse delegate to LPN or LVN? So what do you think the answer? As As I have said a while ago, assessment should not be delegated, so letter A is wrong. And also, when we say admission, there is also an assessment, so letter B is also wrong. So among the two, letter D, assisting client with ambulation, should be delegated to the nursing assistants or UAP. So that's why we end up with letter C. So let's proceed. A nurse has delegated the venipuncture to an unlicensed assistant who has been off orientation for 5 days. The UAP reports this client has a large raised red area where the needle was inserted. The nurse's subsequently assessment reveals a hematoma in the venipuncture area. What elements of delegation have been breached? Select all that apply. So by this question, the nurse assigned a task at which the UAP or UCP evidently was weak, so letter A is included, and did not provide supervision, and letter D is also included. Then the nurse has delegated venipuncture to a UAP or UCP who may or may not be comfortable providing the skills, so letter E is also included. Though the task is permissible in general, venipuncture is not the right task for UAP or UCP. That's why letter B and letter C is not included. So the final answer is letter A, letter D, and letter E. For the next question, upon calling the healthcare provider regarding a client with heartburn, diaphoresis, and irregular pulse, the nurse receives stat orders for the following: electrocardiogram, cardiac panel, morphine 2 mg IV push, nitroglycerin 0.4 mg sublingual, and aspirin 325 mg PO, chew and swallow. Which task should a nurse delegate? Select all that apply.
Come on.
So in this problem, we need to think carefully which among the following can be delegated. So among the following, as I have said, assessment cannot be delegated, so letter B is incorrect.
Yeah.
The nurse caring for the client should administer the medication and continue to assess the client. So giving medication cannot be delegated. So the three final answer is letter C, D, and E. The nurse should delegate the venipuncture, electrocardiogram, and oxygen saturation to nursing unit staff or ancillary personnel. So that is the final answer. So for the next question, a registered nurse working on the medical unit arrives at work 15 minutes late. The nurse is assigned 5 clients and an admission on the way. Place in order of priority how the nurse should complete the following activities at the beginning of the work shift. Place the option in order. All options must be used.
Oh no.
The nurse should start the day by listening to report. This allows the nurse to receive information about the status of each client. So letter A is the first. The next action is to check the clients. The nurse should check on each assigned client to determine the current status of each client. So letter C is next. Once the nurse has checked each client, the nurse should review AM labs. This information gives the nurse pertinent information that helps plan the day and detect subtle changes in a client's status, which allows earlier treatment and preventative intervention.
Come on.
So, letter D is next. Then lastly, the nurse should review the MAR to detect priority medications. The laboratory results can impact the medication given, which is why they need to be checked before the MAR. So the final answer is letter A, letter C, letter D, and letter B.
Yeah.
Now for the last question. A nurse is preparing for a busy day on a medical nursing unit. Prioritize the task and place the option in order. All options must be used. So in this question, you must know how to prioritize. So what do you think the answer? The first priority is the administration of blood product to the anemic client because this client is at risk for decreased tissue perfusion. So letter E is the first one to do. Then, the nurse then should check the post-op client with a nasogastric tube and irrigate the tube to ensure it is functioning properly. So letter A is next. And then, the urinary catheter should be flushed next, while urine will collect in the bladder at first. It will back up into the renal pelvis and kidney if not treated. And then the nurse should proceed to the client with diabetic foot ulcer because dressing changes, while not urgent, are scheduled treatments. So that's why letter D is second to the last. Then the last one is letter C, which is finally, the nurse would recheck the normal vital signs on the 30-year-old or delegate them to an unlicensed assistant. So that's it. The final answer is letter E, letter A, letter B, letter D, and letter C. So as easy as that. Now that's for our nursing leadership and management. Hope you understand it well and watch for my next video. Thank you very much for watching. Bye-bye.